Good morning. My name is Dr. Jelani Ingram. This is Dr. Antonio Rozier, and welcome to a special edition of DOCTALK 360. We have two important trending topics today.
First off, gut check. Jelani, you have a great article today. For the past few years, researchers have been trying to find a way for people to wear or to digest a sensor to monitor your health. In the latest advancements, at MIT, they've packed living engineered cells into a capsule that you can swallow. This capsule is also filled with tiny electronics. So these millions of cells can detect blood. Once they do that, they will light up and they'll send a signal back to a smartphone. Then the doctor, the nurse, whoever healthcare professional gets information can then use that for the patient. This is amazing for the future. Imagine if we could detect things like colon cancer, a bleed in the gut with just a small pill.
It completely changes the landscape of how we diagnose things. I mean, could you imagine diagnosing something like malaria or treating something like malaria all the way to Alzheimer's disease using something like a time-release capsule?
Exactly. And also, too, a lot of these capsules also use the technology from using radio waves to actually charge the capsule, and it sends signals back and forth from the pill to the receiver and back to the pill again.
Wow, so that means that you actually spend less time removing the capsule and more time treating the problem.
Exactly.
For our next topic, we're going to our American healthcare system. Wow. There's been a big change, well, possible big change, to something called the Risk Adjustment Payment System that was attached to the Affordable Health Care Act back in 2014. What this did was allowed insurers to be paid back if they carried a large number of unhealthy patients. So now they would be able to use the healthy premiums, switch those over to the unhealthy side, and be able to still, I guess, care for the patients.
Oh, that's interesting. Imagine what this could mean for the American taxpayer also, right? I mean, you know, I understand that the government will give subsidies to low to moderate income citizens, right? Based upon what the premiums are. So who's paying for that? I assume that's the American citizen, right? That's our taxpayers' money used as a subsidy. So what happens when the premiums go up? Does that mean we pay more?
We're talking about $10.4 billion in 2017.
Wow, that's a lot of money.
So insurers, large insurers are gonna want that money back because they're used to using it to help people or to take care of people.
Right. I know already that, you know, in 2019, the insurance companies were already saying they were going to increase premiums anyway.
Right.
And so it's gonna be interesting to see how this all plays out because, I mean, not only are you taking away money on the front end to where you're subsidizing insurance companies for taking care of patients with a lot of medical problems.
Right.
Now, on the back end, as citizens, we're gonna be footing some of this bill also.
This is a rule that we'll have to keep track of and keep an eye on because this may have long-term consequences or this may just go away. This could be a plan that we just don't know what's gonna happen just yet, but may work out.
Yes, I know one thing, Jelani. Patients need help in healthcare right now. Patients need help affording for procedures and medication, and something's gotta change soon.
Well, thank you for joining us for the special edition of DOCTALK 360. Make sure that you follow us and you like our page